All right, our first guest today is Dr. Kimberly Costas. She is the Medical Director of Thoracic Surgery at Providence Regional Medical Center in Everett. And we're going to be talking today about lung cancer screenings and awareness. And, of course, we talk about all kinds of screenings, Shannon, that need to be done. And lung cancer is, I guess, one that some of us don't tend to think about, especially if we're not a smoker. But it's something that needs to be taken care of.
Yeah, we've talked a lot about cancers, any type of cancer out there, particularly, caught early, treating and outcomes. I mean, the early intervention, you're going to have better outcomes. I think I read somewhere the other day, I think lung cancer, believe it or not, Tom, is in the top 6 cancers or something like that. It's more prevalent than I think we think, but we can screen for it. And that's what Dr. Costas is going to talk about.
And here she is with Shannon O'Kelly.
Dr. Costas, welcome again to Health Talk. Thanks for coming back with us. I can't remember, you've been on before. But again, tell our listeners, you're a thoracic surgeon here at Providence in Everett. But what is your practice like? What is your interest? And we're going to talk about lung cancer screening today. But I wanted to kind of give our listeners an update on your practice and your interest.
Well, thank you so much for having me back on the show. It's a pleasure. So I am a general thoracic surgeon at Providence in Everett. And I have been here for 15 years now. I started in 2006. My focus is all general thoracic surgery, but in particular lung cancer and lung cancer surgery. And within that niche, robotic thoracic surgery for lung cancer.
Okay, interesting. Lung cancer. Let's talk about lung cancer. Give us some stats on lung cancer. I know that there's certain cancers. How does it rate in prevalence in the United States? Is it like a top 5, top 6? Where is it at?
Yeah, it's the second most prevalent cancer in the United States, but it's the number 1 cancer killer. It kills more patients than breast, colon, and prostate together.
Wow, that's interesting. I that surprises me because I hear so much more about breast and colon and prostate than I do about lung cancer. Let's talk about lung cancer, second most prevalent cancer. And you said it's the leading cause of death behind what other cancer did you say?
It's a leading cause of cancer death, and it causes more deaths than the combination of breast cancer, prostate cancer, and colon cancer combined. Again,
this is why I love doing this show. I always learn so much every day. What is lung cancer? What's going on there? Is there different types? Who gets it? Is there a gender specific? Is it environmental? Let's talk about lung cancer in general.
Yeah, I mean, there are 2 main types of lung cancer. The most common type is called non-small cell lung cancer, which has a couple of different varieties. Smoking is the cause of 85 to 90% of lung cancers, although some lung cancers can be environmental, from other carcinogen exposure, from radiation exposure, and even in a few instances, familial.
What about these people? You called it a small cell cancer. What's the other type then?
So non-small cell is the most common type, and then confusingly, the other type is small cell lung cancer, and small cell is a very rapidly progressing cancer. We try to find patients with non-small cell cancer early in their disease because that's where we can have the most impact.
Let's talk about the screening process, detection, and then we'll get into the treatment and where you come in as a thoracic surgeon. So let's talk about screening, can we?
Yeah, thank you. So we have been running lung cancer screening at Providence and Everett since 2014. The National Lung Screening Trial, which was a huge trial that came out in actually 2011, showed a decrease in death from lung cancer by screening patients with a CAT scan every year. And so there was a certain cohort of patients that showed benefit with lung cancer screening. And that cohort has been updated actually just this year to include patients between 50 and 80 years of age, patients who have smoked for 20 pack years. And what that means is you smoke a pack a day every day for 20 years. And those patients are still smoking or they have quit within the last 15 years. So patients who meet that criteria are eligible for low-dose CT scan screening for lung cancer. And the program, patients will come into our program. They'll have a shared decision-making visit, which means that you meet with me or one of my colleagues to talk about the risks and the benefits of the screening. And then you'll go on to get your CAT scan. If there's no findings, we screen you annually. If there are any findings, like a small nodule, then we would follow that based on the recommendations from the American College of Radiology for lung cancer screening.
More with Shannon O'Kelly and Dr. Kimberly Costas next on Como.
It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hudler and Shannon O'Kelly with more IRG Health Talk.
We're continuing to talk about lung cancer screening with Dr. Kimberly Costas and Shannon O'Kelly.
Dr. Costas, again, thank you so much for joining us again here on Health Talk. Very important topic. We're talking about lung cancer. We're talking about screening. You mentioned people that should be screened. You talked about a research that looked at screening. I mean, I'm sure if you detect this early, this is one of those cancers, like all cancers, that if you can get treatment early and detection early, survival rate is increased. So people shouldn't be afraid to come in and get screened.
Yeah, that's a great point. I appreciate you making that point. If, unfortunately, most lung cancers are asymptomatic, meaning people don't feel them. And so when patients come in, a lot of the time, up to about 65% of the time, 70% of the time, the lung cancers are advanced. So what we want to do is find them way early when they're small nodules with no spread to lymph nodes or surrounding structures. That's where we can make the most impact. That's where we can operate for cure. So that's what we're doing with the lung cancer screening program.
Yeah, and the screening program, and again, you talked about people that have a history of smoking. There's an age component. Why? I'm 59 years old, and my family physician has never even mentioned. Like a colonoscopy is just kind of a common thing at 50 or so. But why do not family physicians or other doctors say, "Hey, go get screened for lung cancer"? I mean, is that getting more common?
It is more common, and we still are trying to get the word out to everybody. The United States Preventative Service Task Force recommends lung cancer screening. Centers for Medicaid Services, or basically Medicare, Medicaid, recommend lung cancer screening. So it is a national recommendation, again, for patients over 50 and who have smoked a pack a day every day for 20 years or 20-pack year history.
Okay, so if I can detect this, or we can detect this cancer early and in the hands of a thoracic surgeon like yourself and others, what is the process of treatment? And then maybe we can talk about survival rates, I'm sure they're increasing survival rates with early detection and just modern medicine.
Absolutely. So for early stage lung cancer, the best treatment is an operation to remove the lung cancer. And we used to do that by making a pretty big incision on the side of the chest and cutting ribs, et cetera. And we no longer do that. We do minimally invasive surgery using the Da Vinci surgical robot. So the patient gets a handful of tiny incisions on the side of the chest, and we use a 3D 10-time magnified camera to see inside, and instruments that translate the motion of my hands into very fine motion so I can do fine dissection within the chest. Patients are in the hospital 1 to 2 days and are able to return to normal life pretty quickly after that operation.
Yeah, and then the operation, removal of the cancer, and then you're probably going to follow these people. But the point is, as we wrap up, because this has been great information, I'm so thankful for people like you in our medical community that are doing these things. Because again, early detection leads to increased survival rate. And get screened. Don't be afraid. Reach out to your family doctor if you hear that you might be in one of these categories, and take the opportunity for getting screened. Right? It can't hurt. Right?
That's exactly right.
Yeah. Thank you, Dr. Costas. Great job. Appreciate it.
Thank you very much.
We've been talking about lung cancer screening, Shannon. My mom, I lost her to lung cancer. She was a lifelong smoker, and we tried to get her to quit. But it's something that the screening can at least, hopefully with an early detection, give you a chance to get rid of it, or at least have an extended lifestyle.
Yeah, again, we go back to early detection and better outcomes and better treatment. And so don't sit on the sidelines, so to speak. If you want to get screened, you should get screened because, like I said, early detection, better prevention, better outcomes.